welcome to the seminar. I'm glad you could take the time out of your day and attend. This video will be discussing the condition of autonomic dysreflexia, or rather what some academics might also refer to as autonomic hyperreflexia. If you're someone who is part of a trauma team, an intensive care unit, or a paramedic, or a caregiver, or someone who's affected by a form of paralysis from either a spinal cord injury or a disease like multiple sclerosis, Guillain-Barré, you might face this condition at one point. So it's a good idea to be prepared. First, let's break down the terminology of autonomic dysreflexia. Dys refers to bad or difficult. Reflex is an action performed in response. So tying these together, autonomic dysreflexia is the bad response regarding the autonomic nervous system. Okay, so we got that under our belts. But what does it actually mean? Well, according to an Iggy book, let's see here, they say it's a potentially life-threatening condition in which noxious, visceral, or cutaneous stimuli cause a sudden, massive, uninhibited reflex sympathetic discharge in people with high-level spinal cord injury. Well, maybe we should try this one, the Huther and McCain's. They say the syndrome of sudden, massive reflex sympathetic discharge associated with spinal cord injury at level T6 or above. Well, they both of those textbooks use the word sudden, massive reflex sympathetic discharge. We'll break that down a little bit further here. So depending on the degree of damage to the spinal cord, let's say an injury due to a car accident, paralysis may occur. The injury could be a spinal cord compression, a laceration, or a complete transection. There could be a complete loss of motor function, loss of tendon reflexes, loss of bladder control. There could be varying senses of pain, temperature, touch, or pressure. So if someone with a spinal cord injury can't feel a sensation that is aggravating the paralyzed part of the body, the autonomic reflex will respond. The response to this aggravation is a constriction of the vessels, which raises the blood pressure, making the skin cool with goose flesh or piloerection. This is the sympathetic reflex, what he was saying, the sympathetic reflex. The onset happens suddenly. Again, what they're saying, sudden sympathetic reflex with the sympathetic flight or fight response. However, this all happens up to the point of the lesion in the spine. So the counterbalance of the sympathetic reflex will respond to the parasympathetic response. The body wants to lower the blood pressure because it doesn't know about the aggravating factor. So above the lesion, the body will dilate the blood vessels, flushing the skin as well as sweating. Whoa. Stop right there. So how can the body know to kick in the counterbalance? Let's say the spinal cord is completely severed. How does it know? How does the bottom half of the body tell this to the top half of the body? Hasn't it lost all the functions mediated by the spinal cord? Well, yes, it has. That's true. But the blood is still circulating in the body. The body can communicate through the blood hitting certain baroreceptors near the heart. The vagus nerve, originating from the brain stem, travels all the way down to the kidney, hitting the trachea, the heart, the stomach, the intestine, liver, pancreas, all along the way. So the body can still communicate. So what are some factors that may aggravate the body? It was mentioned earlier that even though pain sometimes can be felt, it's still affecting the body. So what are some factors that may aggravate the body? It was mentioned earlier that even though the pain can't be felt, it's still affecting and stimulating the body. Something as simple as constricting clothes around a body part, or something that stimulates the pain receptors. This is a fight or flight reflex. Most oftentimes, though, the bladder is full without them knowing, but it's still full, so it needs to be emptied. The body needs to rid that urine, so you have to act quickly. So what do you do when someone's showing these manifestations? Well, first off, you elevate the head of the bed to alleviate and promote drainage of the head. It'll alleviate and decrease the intracranial pressure. You check the blood pressure every 2 to 5 minutes. Then you assess the underlying condition. Is it the bladder? Is it the bowel? Is it the pain on the skin? Breakdown, perhaps. All right? So prevention is key. Reduce painful stimuli by keeping blankets and sheets flat. All right? Be cognizant of sharp and hard objects. Monitor the intake and output. And then you got to be cognizant of the environmental temperature fluctuation. So thank you all for coming. I'll be handing out a scenario for you guys to all discuss and try and figure out and work through and determine what the next steps are after during that scenario. Discuss with your neighbors and have a good time, fun time.